Good evening. Thank you for joining me, Sophie Matovu, on U Health Chat. It's always a pleasure to come out to you and to bring topics that are of interest to you, topics that carry a lot of weight, where you'll get to learn a new thing or two. Now, today we're going to talk about World Hepatitis Day that takes place every 28th of July. It is a day where they come together to talk about the topic, raise awareness of the global burden of the viral hepatitis, and to influence real change. The global thing this year, that's global. We are not waiting. In other words, they're not going to wait. But I'm not the expert when it comes to these matters. With me in studio to shed more light on the topic of discussion is the Assistant Commissioner, Palliative Care and Hospice, Dr. Moses Muwanga from Ministry of Health. Good evening, Doctor.
Good evening to you. How are you?
Thank you. Fine, thank you. Now, Doctor, we will get straight and dive into the topic. When we talk about hepatitis, vaccinations have gone on. Lots of people hear hepatitis. What is hepatitis? Because I guess they are more used to the commonly regular conditions or diseases. What is hepatitis?
Thank you so much. Hepatitis is a viral infection. And this is a virus which affects basically the liver. So there are different types of hepatitis. There's hepatitis A, hepatitis B, and hepatitis C. But all these different types of hepatitis, once somebody gets it, it affects the liver. That liver, if not treated, it advances to very severe state. The liver, if not treated for a long time, it becomes cirrhosed, fibrosed, and later it can become a liver cancer. The different types of hepatitis have different modes of transmission. In Uganda, we basically have hepatitis B, but hepatitis A and C, especially hepatitis C, we have a very little prevalence. Between 1 to 2% is hepatitis C. Hepatitis A is also in particular areas, because its mode of transmission is basically because of hygiene purposes. It's fecal-oral transmission. If somebody hygienically is infected with hepatitis A, he can transmit that to other members through food. If he touches food or water, then a person can get hepatitis A. But the commonest in Uganda is hepatitis B. It's very fatal and very dangerous. It's the one we have. And basically across Uganda, especially in West Nile and Lira, this is where we have a bigger prevalence, which ranges between 4 to 5%. Other region, the prevalence is not as bad as within that area of the country.
Now, what are the causes of this hepatitis B, and why specifically in those regions? Because there are certain times when it comes to, like, if you talk about malaria, you might be able to say this region, the malaria is on the high because of this kind of conditions, or the weather is conducive for the mosquitoes. Why does it turn out that way for the hepatitis B?
Basically, when you look at hepatitis A, it's basically, as I told you, sanitation, hygiene. So regions which don't have proper toilet system, no clean water, these are the areas which have a lot of hepatitis A. Hepatitis B is basically spread by it's blood-to-blood transmission. It's just like HIV. The spread of hepatitis B is through, where we have the biggest transmission is mother-to-baby transmission. Once a mother has hepatitis B, he can vertically transmit that hepatitis to the newborn baby. Then it can also be just as a horizontal transmission. You find that through sex, unprotected sex, people can get that. Sex workers can get hepatitis B. We have areas whereby people use unsterile instruments. We have regions whereby people have cultural practices. People have circumcision without sterilizing instruments. People have scarring. People make different scars, like women enjoy making different scars onto them. So in that process, they can transmit hepatitis B. So they are also drug users, people who use drugs. They use unsterile needles. You know, needles, they keep on reusing the needles, so somehow they can get that transmission. So you find that hepatitis B is spread, even blood transfusion. If you get blood transfusion and the blood was not checked well, and that blood had hepatitis B, you can get transmitted. You can get
infected.
So you find that in some of our areas, people still use such methods. We have sex workers. So these sex workers also can get hepatitis B. Yes.
Okay. Now I'd like you to take us a bit more into the disease burden in Uganda as a country. Is it one of those issues that we should really be very concerned about?
So when you look at the global burden of hepatitis, you find that across the whole world, we have over 257 million people suffering from hepatitis.
Wow.
Globally, it's a big number. 257 million people have hepatitis, so it's a global problem. Now, 68% of that number is in Africa. So when you look at it at a global part of it, you find that there's a big number of people who have hepatitis, but the biggest percentage is within the African continent, whereby it is, and Uganda is part and parcel of those areas. So when you come to Uganda, you find that in the West Nile, around Acholi region there, the prevalence is between 4 to 5%. When you come to the central region, the prevalence changes. It's around 2 to 3%. When you go to the southwestern region, the prevalence of hepatitis also changes. But there are some areas whereby the prevalence goes up to 20%. Some dockets within the country, the prevalence goes up to 20%. That means out of 100, 20 people have hepatitis.
Wow.
And once these people get it, they can spread it to other people. So you find that when you look at a country as Uganda, we still have hepatitis as a problem. And once hepatitis B, somebody gets hepatitis B, it's a chronic infection. He gets it, hepatitis B has no cure. But if you diagnose it early, you can prevent, you can prolong your life, and your liver doesn't get into the advanced stage of liver cancer, and somebody can live longer. But if that person does not get treatment, he can spread hepatitis B. So you find that as a country, we have that as a problem, which could be preventable, because hepatitis is preventable. So I am sure that while we are here, we want to make sure that people are aware of hepatitis. What is it? What does it do? The mode of transmission, so that they can know how to prevent themselves. If you can use sterile instruments, we are calling upon, you know, there are some centers whereby they have to be very careful. There are some dockets of people we need to prevent, the health workers. They are always working with people, helping them. They can get infected. The sex workers, once into their casket, one of that person has hepatitis, he can spread that hepatitis. We have incidences of blood transfusion. So we collect blood from the population. So we need to ensure that our blood we have collected
is
from the donors is safe. We need to check that blood and ensure that blood does not pass that infection to others. The other mode of transmission is the mother-to-baby transmission. So we have to make sure that the mother does not infect her newborn baby. So that is another mode of transmission which can become. We also have sex workers, men to men. They can also transmit hepatitis. So we need to also look at all those dockets of the risk population and ensure that they don't infect others.
Now, at least I know there are certain things which are routine and mundane. Like when pregnant mothers are undergoing antenatal, you know that the HIV testing is done. And is hepatitis one of those that is catered into? Because, or do we wait for people to, you know, go through, our Ugandan routine is like, when you feel unwell, the first thing you suspect is malaria. You know, we start clinically diagnosing ourselves. So we say malaria, then you go into anti-malarials, and when you're done with anti-malarials, now by this time the disease is progressing. What is the situation like? What is the strategy in place to ensure that right diagnosis is done?
I think as a country, as Minister of Health, we really want to thank the Minister of Health, our minister and the team, because as a country, they have started screening programs. Especially their screening programs for the pregnant mothers. And ever since 2002, they established a vaccination of hepatitis into the EPI programs. The routine vaccination of children, right away a child is born, he gets a vaccine, the prevalent vaccine of hepatitis. It's a combination. And that child gets that combination at birth, 6 weeks and 10 weeks. And so most of the children who were born after 2002 are protected. So the mothers who are pregnant are screened for hepatitis. And once found negative, they are vaccinated. So it's a program which Ministry of Health and Government of Uganda is running through. Then we have screening programs whereby we screen. As soon as we screen people, those are the people who were born before 2002. These are 18 years and above. Then we screen them, and once they are negative, we ensure that they are vaccinated. And please, once you find yourself negative, ensure that you get 3 doses of hepatitis vaccine. Because if you get 1 dose, it's not a complete dose. You don't get complete protection. But if you get 3 doses of hepatitis, you get 0 dose, then after 1 month, and after 6 months, then you are protected in one way or another. So that screening, we have ensured that all our health center 4s, regional referral hospitals, general hospitals, and our national referral hospitals have facilities which test. The laboratory, the lab services test for hepatitis. And it's something which they do as a routine. When people come there, they test them. And once they are found negative, they are vaccinated. 3 doses, then they are protected. Those who are found positive are referred for treatment within the same facility. Not everybody who is found positive deserves treatment.
Okay.
We need to check their viral load.
Just like HIV?
Exactly.
Okay.
So as soon as you find yourself positive, please go to the health worker within the public facilities. Even some private facilities do offer. But our public facilities, the treatment is free of charge. The tests are free of charge. So when you go there and they find yourself that you are positive, in our lower facilities, we have a hub system. A hub system is not all our facilities, especially Health Center 4, can do viral load. So we use the central laboratories. So we collect the samples and refer them to that central laboratories for testing the viral load. Results are brought back, and once that person is eligible to start onto the treatment, he started on treatment.
Talking about the treatment, what kind of treatment is this person started on?
Ideally, these are viral infections. So we start them on antivirals. Remember, you started on antivirals, they have to assess you. It's not a matter of starting on antivirals. Other tests are taken as well. We do your blood chemistry, the hematology of your blood, to look at how is your liver, how is your system before we start on to your drugs, how your kidneys function. Then they monitor you and treatment is started on you. Please, if you find yourself positive with hepatitis, get referred to a government facility, a public facility. I want to tell the community that we have specialists, we have people who are trained in managing hepatitis. They will counsel you. It doesn't mean once you get hepatitis. We have so many people who have been found positive and they have turned into chronic hepatitis. They have started on treatment and they are surviving.
Okay.
I'm sure during our celebrations, we are going to bring some of our survivors to tell the story. Somebody tells you, how do you live? Remember, as soon as you get hepatitis, your liver is affected. Diet is part and parcel you need to look at. There are certain foods, there are certain drugs you're not supposed to take as a person because it overburdens your liver. So you need to look at, you need to be supported by a group of people, a social worker, a counselor, a physician, and a lab technician, because it's a package. People need to guide you. People need to reassure you. how are you going to live with your family and you don't infect them in a way? Because remember, even your people who have contacts of a HIV positive, of hepatitis positive person, they are contacts and they have to be checked each and every the other time.
When you talk about this, it's really, how should I say, I'm looking for the right word to use, because I know for a fact, like given with what you have said and what one has to go through, and you've talked about the regions in Uganda that are highly affected, how are these people really sensitized? Because until we fall sick, for us, we believe we are always okay. We never have the culture and the system of going for just a routine check. Self-care is lacking. How are those areas, people in those regions, being supported to know that this is what is in your area code?
Ideally, as I was telling you, as part of our intervention is awareness, health education. We are doing a lot of mass awareness, and ideally, even the mere celebrating this Hepatitis Day, one of the things we are looking at is public awareness. Once you give people information of how the disease is transmitted, how you can prevent it, and how you can care for yourself, I think it makes a lot of sense. So we are looking at one of the objectives of even this show is to engage everybody. Everybody can be a player. The community leaders, the religious leaders, the cultural leaders, and the policy makers, especially our parliamentarians and the local leaders. At every level, you can pass on the information. As soon as somebody gets hepatitis, there are signs and symptoms which are seen. Because ideally hepatitis, and in many cases, people know, before people see, this person has got yellow eyes. Okay. It's a sign whereby you say, yeah, probably he has a problem of that. You get yellowing of the eyes, even your urine becomes very dark yellow. Remember, your liver is affected. Your appetite becomes so low, you don't feel like eating, you have joint pains, and at times you get fevers. They always get a fever. And they always have very sharp pain on that side of the liver. And at times their liver enlarges. Okay. So some of these people, depending on even on their history, the way they are living, if they are sexual workers, then you have a high index of suspicion as a health worker and guide. So we are telling the community that once you have a suspicion that probably somebody has hepatitis, refer them for the tests. We are also carrying out mass vaccination, especially in targeted areas. And I think this has been done some few years back, and it was done in a phased manner. We started with the entire north, whereby we knew that area had a high prevalence. So we had to do mass vaccination. Then the second phase was within the center and the southern western region, which basically has a very low prevalence. Then after that, we are now doing mop-up, because ideally all the services, the facilities of testing, screening are available within. Then another intervention we are doing is routine surveillance, because our facilities right away from Health Center 3, 4, general hospitals, regional referral hospitals, they collect data. Whenever the lab person tests and find that this person has hepatitis, that data is incorporated into the district data. And from the district, we get that data at the Ministry of Health. It sparks off, then we can look at probably there's a problem in this area. And then we send a team to do something.
Okay.
Yes, please.
Now, when you talk about what you've done, how was the response? I'm just curious to find out, how was the response in terms of people being responsive and coming out to get vaccinated? Because, you know, like certain times people have their own myths and misconceptions about vaccines. What was the response like in those areas?
Ideally, if you give people information and they know that the treatment is there, services are there, they come. What disturbs people basically is, just as you said, the myths. Some people feel that hepatitis is contagious. Please, hepatitis is not spread by sweat. Greeting doesn't spread hepatitis. Hugging doesn't spread hepatitis. Sharing food, unless when you have hepatitis A and you have infected that food, this is when you can spread. Hepatitis B does not spread by sharing food. So those myths at times make people hide. People think, there was one time when people thought that probably the vaccines had problems. So what we do as Minister of Health, we always have champions. And I want to thank the Minister of Health, our Permanent Secretary. They are always the first people to be vaccinated. They always launch these activities, and they are the first people. I personally, I remember when I was in a regional referral hospital, as the head of that hospital, I had to be the first person. You know, you have to walk the talk.
True.
Once you are vaccinated, then I'm sure other people
Will also follow.
follow. Our president on many occasions has always been a champion onto that. So I think we can't deny the myths. But when we use champions in regions, we have always used the bishops. The kingdom has also, once in a while, the Kabaka has become a champion in many of these vaccination activities. So I think we still have a culture of people having myths onto this. But through continuous information, health education, campaigns, I think we have done something. Because at least now, we are sure that if we have a bigger mass of the children being vaccinated when they are young, the mothers are also being vaccinated. They are checked and vaccinated. Then we target the risk groups. I didn't talk about the soldiers as well, the armed forces. These are also people whom we always target. The prisoners, those people who are together, we always target them. And we vaccinate them, we screen them and vaccinate them. And our major important role is to use all forums, ensure that people understand what hepatitis is.
Then at what stage, because when you talked about some of the signs and symptoms, and you talked about the yellowing and the sharp pain, do we classify that as the chronic stage? You just like, the final, it's a stage still where you can be able to intervene and be able to capture and manage the disease?
Not everybody gets those signs and symptoms. Some people totally become asymptomatic. They don't have anything. They are normal, just like us. There are others who get it. But not all the yellowing and the fevers is hepatitis. Malaria can also be that. Babies are born with neonatal jaundice. They can get that. But at least you have a high index of suspicion. But the initial stage of getting the acute hepatitis, you get a fever, you get the yellowing. Why the yellowing is because the cells of your red blood cells are being destroyed. There's a lot of jaundice, which bilirubin comes in, and that is the coloring which you see on your skin and in your eyes.
Okay.
So it's just the initial stage. But once it becomes advanced, it goes into the liver getting inflamed. Fibrosis happens into the liver gets scarring,
gets enlarged.
then enlarged, and then cancer comes in. Liver cancer is very fatal and very difficult to treat. You'd rather avoid, and the biggest cause of liver cancer is hepatitis.
Oh, wow.
Although also alcohol
Can cause that, yeah.
Yes.
Okay. Well, at this particular time, I would like us to take a very short break for just like about a minute or two. And then when we do come back, we're still going to continue with this educative topic of discussion.
Jerry con. Jerry con. Hey, Master Blaster. Touch him, man. Bang Jerry con with muscle. Those ones who say go for you only. Mundava. First group is I teach you. But never come with the muscali. Because of the cover is very far. Is you serious? Is yes you. What? Yeah? You step it on it. Add kilometers to your legs. And you get your sugar. We buy meat from Umaru. And Umaru refuse to give you enough meat. Show him that they don't joke with you. Umaru,
okukakaluka n'okulungi kwetaagako omuntu akuyambako n'olwekyo tujja kukuteerawo embeera esaanidde osobole okukola ekisinga awamu teri kitulema.
High, a high school TV drama that you do not want to miss. Who takes the title for the most popular and cool girl and boy in schools? Who are the good students? Which part were you during the high school times? Come and be part of this epic high school series movie premiere as you relive your school drama times. Tickets go for 30,000 ordinary and 50,000 VIP. Early bird will pay 25k and 45k respectively. 21st July 2023 at the National Theatre. Contact us on 0784 930190 or 0703 826623 for details. Sponsored by Bella Wine, Charism, UBC and U24 TV.
Road traffic crashes is one of the leading causes of death among young people aged 5 and 29 years. In 2022, Uganda registered 21,473 crashes, out of which 4,534 people died and 15,227 seriously injured. 22 people die every 100 crashes, and on average, we lose 12 people daily. Legacy Road Safety Initiative, in partnership with KCCA, Ministry of Works and Transport, Ministry of Health, Uganda Police Force, Red Cross, Rosaku, Boda Boda Industry Uganda, have organized the second Road Safety Marathon for the crash victims to help create awareness, build cohesion among stakeholders, train first responders at black spots, and support a health facility. The marathon will take place on the 23rd of July 2023, starting at 7 a.m. from Nakasero Primary School grounds. Book your kits at 25,000 from Legacy Road Safety Initiative offices located at Old Kampala Chicken House, 2nd floor, room 18, or 8th Street, Safeway, Rightway offices, Total Energies, Ovino Mall, Boda Boda Industry Uganda, or visit www.lrs-initiative.org to register. Call 0752 605 479 or 0776 598 817 or 0414 698 675. Proudly powered by Daxi Driving School and Wava Water. Run to save a limb.
Welcome back from that short commercial break. You're still watching U Health Chat here on UBC TV. And of course, we're talking about World Hepatitis Day. With me in studio is none other than the Assistant Commissioner of Palliative Care and Hospice, Ministry of Health, Dr. Moses Mwanga. Now, Doctor, I would like us to dive back into our topic of discussion. I believe with most of the disease burdens, there are always challenges. There are success stories, but there are also challenges. So what are the challenges that the ministry is facing in line with the hepatitis?
Thank you so much. I think the challenges are there. One of them being limited advocacy, especially in the communities. Lack of awareness. Because some of the communities, we need a lot of advocacy into them. We need champions in those communities to ensure that they really understand. And this goes hand in hand with the misconceptions. People have a lot of myths and anxiety. Just as I told you, a person thinks that once you get this disease, you are done. Probably it is spread by sweat, by greetings, by sharing foods. So those myths are still there in some areas. Then we have also limited partners supporting hepatitis. We want to appreciate partners who have been with us into it. WHO is always very supportive. UNEP is very supportive, especially on the immunization program. WHO on guidelines supporting us. There are also other local partners who are with us, but very few partners, especially in some of those areas we have mentioned, which have a very high prevalence. They have limited partners who support in one or another. The knowledge of our health workers. Not all our health workers, I would say, are very conversant with hepatitis. Because we keep on training people. Hepatitis needs a bit of specialization, skills, understanding the disease and how to manage. Hepatitis is more or less like HIV because it's a chronic infection, and various stages of hepatitis, people need to understand how to handle this. So the knowledge in our health workers is also lacking, not everybody. And some of them may have shallow knowledge and they may not give a complete package. We need many people to support in one or another. Once somebody has hepatitis, the counselors. Because ideally hepatitis is a chronic infection. And even my division, palliative care, comes in because somebody has to understand he's going to live with this limiting disease throughout his life. How does palliation come in to support this person? So I think we have very few people who understand that, who can support those people. Then the medication, stockouts of the kits, the viral load. Of recent, we have been having issues whereby people are saying we're only screening mothers for viral load, but that was a priority because we thought that all mothers should produce babies who are negative for hepatitis. But you find that in some areas, they had a priority. Once the kits were few for the viral load, the pregnant mothers would take
top priority.
So we are having challenges of stockouts in some areas. Even the medications per se, the antivirals, were also a bit of stockouts here and there. In some few facilities, they have been there. The worst part of it is the high dropout. People, once you start them on treatment, they feel better, then they drop out. And they think, for me, I'm better, and they disappear into the community. They only come back in advanced liver disease.
Oh, wow.
So this is something which I think is a bit of a challenge, and it's a bit of an issue. Then our hepatitis, checking our screening our mothers, the guidelines. I think there are some regions they have not been scaled to, and ideally even our Minister of Health wants to launch the first dose, birth dose for the mothers. This is something we want to launch, the birth dose for the mothers of hepatitis, such that we ensure that all the babies born have no hepatitis. So I think these are some of the few challenges we are having. Even the kits for checking for hepatitis, once in a while, they go missing.
Okay, now when you talk about it, you know, given the fact that we have very, how should I say, there are some pharmacies, pharmaceutical companies in Uganda, where somebody will know if you're looking for a specific drug, this is where to get it. Don't we have some of these, often some of these big pharmacies where somebody can be able to afford and purchase them from themselves, or it's a rare drug on the market?
I would say it's available, but most of the biggest population of our people are poor.
I know.
They can't afford it. This is a medicine you need to take for life. You may start the first initial treatment, but it's for life. So at times it becomes very expensive. That's why the public facilities are offering it free of charge. And remember, whenever you're on this medication, there are some particular tests they need to check. How is your liver function tests?
Which are also
the
costly.
Kidney function tests. How is your CBC, the blood function tests? So you find that it's not easy to manage it on the private basis. That's why government took it up
Okay.
to ensure that we support.
Now, in areas like, I know for a fact, like if somebody defaults on ARVs, I'm just giving an example, that when they advance, the disease burden advances, then you find that they have to alter the treatment they're using. What's the scenario like when it comes to hepatitis?
Once somebody defaults, then you need to alter the medication, which is even twice as much as expensive. Remember, altering means why we give them antivirals is to stop their liver damage.
Okay.
So by the time they come, you can never reverse what has gone. Once the liver is damaged, it's gone. Even if you alter the medication, you know, it is already done. The damage is done. And in many cases, the liver fails. And once the liver fails, death. So many people who have dropped out, they come in advanced liver disease, liver failure, and once the liver fails, other organs fail as well, and death
sets in.
sets in.
Okay. What are the recommendations that you'd say you have, and in terms of priorities?
I think the recommendations basically as ministry, we think we need to scale up the pregnant mother testing using the WHO guidelines. So if we have that done, then we need also to have the systemic screening policy. How do we screen? And then we mop up some of those people who are still positive. We need to have that done. Then we also need to increase our awareness, publicity. How do we get many people, the public understanding? If we get many of those people, I think it will help us mop up. We have champions in various regions. We have religious leaders. We have member of parliaments, the local leaders, the community, not forgetting the cultural leaders. Because many of our people, when they get hepatitis, remember they end up in shrines. So if we also use those people to pass the information, to understand that if somebody has this type of disease, it's a chronic disease, fine years come to your shrine, but refer them to the best medication. Counsel them, refer them there. We also need to strengthen our health system, our health workers, educate more of these people, collect data, and have those focal areas. Ensure that we monitor our supplies such that the stockouts are not as bad as they are. We monitor our data and plan well. If our referral system can be done in a better way, because we also have health center ones, these are the village health teams, health center twos. Once they know the signs and symptoms, they could refer somebody to health center 4 or a general hospital or regional referral hospital for support. I think that one can help us in one way or another. Then advocacy. We need a lot of advocacy at all levels, even at the parliamentary levels. Because in parliament we have a health committee. We need them to really understand that hepatitis is a burden.
Yes.
It's a public nuisance. How do they increase funding for this docket in the Ministry of Health? Because it's a continuous process. And remember, whoever joins our docket as a chronic hepatitis patient, he will live for life with it. He needs support. I think we need a similar support like HIV to support the hepatitis people.
Okay. Now coming to the day, which is on 28th, how do we, Uganda as a country, how are we planning to come out to be able to talk about this day, to celebrate it, to commemorate it? What is the plan in place?
I think the plan in place is on the 28th of this month, we are celebrating the World Hepatitis Day in Kazo district. The Kazo Playground, the LC5 Kazo, our permanent secretary, Minister of Health, will be the chief guest. We are inviting everybody to be there. We have a health camp. We are going to screen people. Screen, test, and treat those people. Guide them. We want awareness. We have already started the awareness. I think this is part of the awareness. But we are going to have press releases. A statement will be given by our Director General on hepatitis. We are also going to discuss with the press to tell them, and I'm sure we are going to have a more detailed discussion on this topic because it's very interesting. We had limited time, but I think we are going to have a lot of discussion. And our theme this time is, you have one liver and one life. Everybody has one liver and your life is one. So you should know your status. If you don't know your status by now, I'm calling upon people, join us on the 28th of July. There will be free testing for hepatitis. Know your status. Because if you don't save that one liver you're having, your life is at stake. Be there. Please join us and we celebrate that day.
Then there are certain times when people might feel left out. Yes, it's a routine and it's something we're used to, that on particular gazetted days an activity will happen in that area. So there is this laxity of like, besides it's the other side, what about us who will stay, or those who will stay back here in Kampala? Is there an arrangement? Let's say people come to Ministry of Health for screening, people come for information. What's the plan?
I think the plan is we are going to continue giving information. I think this whole week, starting on Monday, we're going to give people information. All our health public facilities are open. They have kits. Go there and screen yourself. Use this week to know your status. The theme is you have one liver. If you don't save that liver of yours, because not until when you test, you can never know whether you have hepatitis or you don't have it. Because many people walk without symptoms, especially when somebody has chronic hepatitis, he has no symptoms. Probably you may be one of those people. But if you know your status, please be there. Go for testing to any nearby health center for general hospital or regional referral hospital. Then get advised.
Okay. Then I would like you to talk about the issue of self-care. Just like we said, why go to the hospital besides I'm feeling well? I will only go there if I'm feeling unwell. That is our mentality.
Yeah, ideally people, whenever you go for a medical checkup, people think you are crazy. We always take our cars after different mileage. A car, after different mileage, you take it to a checkup. Ideally, even we as human beings would just leave that after different mileage, can I go for a checkup? A general checkup. Check all your systems, right away from the eyes, the nose, the teeth, your blood pressure. The blood pressure will tell you your entire system. Simple things like a random blood sugar. People are found collapsing without knowing. We are getting people getting mental illness. Use your colleagues. Once your colleagues tell you that, I think you're not behaving well, just know there's a problem. Mental illness and stress is killing people silently but surely. And it's a problem. Others have turned into alcoholism, smoking, drugs because of mental illness. Check your heart. Your heart can be checked by checking your blood pressure. You need to check your entire system, even your weight. Once your weight and height, we have a body mass index. Once it goes above 30, especially for men, once you find that you have got a belly, your belt is inside there, then there's a problem. Check your height and weight. Once it's above 30, between 18 and 25 body mass index, you are safe, depending on your height. But once it goes to 30 and above, 35, you're obese. Being obese is not fashion, it's a problem. We are now getting hypertensions, cardiac diseases, strokes. We are now starting to copy the Western style. We sit a lot, we drive, we sit in offices, and we eat a lot. Fast foods, a lot of fats is not helpful. My advice would be, have enough sleep, a minimum of 8 hours. Take a lot of water. Laughing helps you to live more. Please laugh. Husbands who are very tough at home, you are stressing yourself. Laughing is a medication. You use only 3 muscles to laugh and over 30 muscles to become gloomy. Have peace at home. Talk with your people. Discuss. Don't get closed in person. Have a work-life balance. Do a lot of exercises and eat a lot of fruits, less fat, less milk, and a lot of water.
Okay.
Thank you so much.
Thank you so much, Dr. Mwanga. It's been really very wonderful hosting you, and thank you for sharing this very useful and educative information. Now, to you, the person who's been watching, I don't think I need to re-echo anything. Hepatitis B is for real. If you have not gotten vaccinated, I would suggest that this is a time for you to go and check. Once you're found negative, get the 3 doses immediately. But also, take time off, because I know many of you people are always Googling. Mr. Google is helping you to discover many things. Use the opportunity to be able to do your research and get to know more about hepatitis B, because it is really a disease that has no cure. That is what I've got to say. Well, it's just about a few minutes to the top of the hour of 10 o'clock, where we shall be having the 10 o'clock bulletin coming your way with Michael Jordan Lukoma. It is good night from me and Dr. Mwanga. Bye-bye.